South Korea today again reported more than 50,000 new cases of COVID-19. That's double the number a week ago. Prime Minister Kim Boo-kyum says the government is ready to make bold decisions when it comes to the social distancing rules as long as there's not a rise in the number of people who are severely ill. Choi Min-jung reports.
South Korea on Friday saw 53,926 new COVID-19 cases. The country reported more than 50,000 cases for the second day in a row, up more than 26,000 on week. As cases soar, authorities said they will be discussing updating social distancing measures as they are due to expire on February 20th.
It is very important to adjust social distancing to minimize economic and social damage. After closely analyzing and evaluating the situation, we promise to make a bold decision when needed if the number of severe cases and fatalities remains stable and the virus situation can be managed to a certain extent.
South Korea's Prime Minister Kim Boo-kyum also said on Friday that officials are considering a price ceiling for rapid antigen test kits in a bid to secure a stable supply. The government has already decided to ban online sales of the kits from Monday to prevent them being sold at high prices. Officials also said offline sales will be limited to pharmacies and convenience stores. Beginning February 21st, rapid antigen test kits will be provided free of charge to some 2.1 million people, including those at preschools and senior care facilities. Authorities say that's because these people could be easily exposed to the virus based on the time they spend in groups. The government has decided to make PCR tests cheaper and more accessible for people taking care of elderly or sick people by applying health insurance for PCR tests. Guardians and caregivers need a PCR test to be allowed to enter hospitals, but since the testing protocol changed after the Lunar New Year holiday, they have faced difficulties getting tested, as those under 60 can only get rapid antigen tests. This meant caregivers had to pay as much as 100,000 won, or around $83 to get regular PCR tests. But from the fourth week of February, through their health insurance, they will be able to get tested for around $3. Also, up to one guardian will be able to get a free PCR test at a screening center if they come with the patient they are looking after before the patient is admitted to hospital. Choi Min-jung, Arirang News.